turning now to Dr. Arjun Srinivasan. He's with the U.S. Centers for Disease Control right here in Atlanta, where he works on programs to prevent infection. I'm sure you've heard about this warning, doctor, and how worried are you that we are all the infections in our bodies are slowly becoming antibiotic resistant?
Well, we've actually done much more than heard about it. In fact, just last week, we at the United States CDC issued a similar call to action, if you will, about the importance of taking immediate action to stop or slow at least the development of these highly drug-resistant bacteria that we're seeing in the United States, primarily seeing in our hospitals and healthcare settings. We issued a report on a type of bacteria called carbapenem-resistant enterobacteriaceae, or CRE, which in some cases, as Dr. Davies is pointing out in England, are in fact resistant to all of the antibiotics that we have to treat them.
So what should ordinary people, I mean, people watching this right now saying, oh my goodness, if I have even a benign infection in several years, for instance, is it possible that no antibiotic will cure me?
That's the concern. That's the day we want to avoid. And that's the reason why we're calling on people to take action now, because we really do believe that if we take aggressive action now, both to develop new antibiotics, as you mentioned before, but also to work hard to use the antibiotics that we have already available to us, to use them better, to take steps to prevent infections from developing and spreading in hospitals, we really believe that if we take those steps now, we do have the chance to slow the development of this type of resistance. And we believe that way because we've seen it work. We've seen examples from other hospitals around this country, and even in larger areas in national systems like in Israel, where they were able to dramatically reverse the trend with this same CRE organism. They had a very large outbreak of that all over the country of Israel, and were able to dramatically lower the rates of these infections through careful and aggressive implementation of strategies to use antibiotics more wisely and to prevent the spread of infections.
So what do we need to do now? I mean, if somebody is watching right now thinking, should I think twice about taking antibiotics for an infection in my own body because I will be getting my body used to this antibiotic? Is this something that people should think about now, or is it all on the drugs companies?
No, I think everybody plays a role in this. So this is something that all of us have to work on together. I think what viewers can do is to listen to the messages and to not demand an antibiotic. If your doctor says you don't need one, then don't demand one. Don't insist that your infection requires an antibiotic. What we do see is sometimes people will demand an antibiotic from the provider, and a healthcare provider, a doctor or a nurse may give in to that demand because they think that's what the patient wants. So as patients, we can do a better job of, if our doctor tells us we don't need an antibiotic, not demanding one. We can wash our hands when we are visiting our loved ones in the hospital, find out what the hospital wants us to do to help prevent the spread of bacteria. Healthcare providers obviously play an important role in all of this as well. Public health plays a big role. Drug companies play a role. We all have to work together. This is a big problem, and it has many facets to it, and we all have to work together to address them all.
Doctor,